Over 60? One vitamin restores leg circulation, not magnesium. Hey there, seniors. Are your feet tingling? Getting muscle cramps in the middle of the night? Do your legs feel heavy and tired by the time evening rolls around? You might be thinking, well, that's just what happens when you get older. But actually, these are warning signs that your blood isn't circulating the way it should. And if you ignore them, you could be looking at serious problems like blood clots, nerve damage, or even a stroke. Now, what if I told you there's a single vitamin, and it's not magnesium, even though that's what everyone talks about, that could help get your legs' circulation back on track naturally? And chances are, you've already got it sitting right there in your kitchen. I'm Dr. James Caldwell, and over the next 10 minutes, I'm going to walk you through 5 warning signs that your leg circulation is already in trouble, plus the one vitamin that can actually help turn things around. This particular vitamin is the one seniors are lacking most, but it's also the most powerful one for circulation. Before we jump in, go ahead and drop a comment. Let me know where you're tuning in from and how old you are. And hit that subscribe button, because every week I'm here sharing health tips like this one that can truly make a difference after 60. But before we get into that, let me take a minute to explain what's really going on inside your body when your circulation starts breaking down. Because once you understand this, you'll see exactly why this particular vitamin matters so much. Think of your blood circulation like a highway system running through your body. When everything's flowing smoothly, oxygen and nutrients get delivered to every single cell, and you feel energized and strong. But when circulation starts declining, the early warning signs are really easy to overlook. And that's where the real danger is. Poor circulation happens when your blood flow gets sluggish or blocked, especially down in your feet and legs. What causes it? Things like plaque building up inside your arteries, vein valves that aren't working right anymore, high blood pressure, diabetes, not moving around enough, or just the natural aging process. What makes this so dangerous is how quietly it creeps up on you. Swollen ankles, cold toes, a little discomfort here and there. Most people just brush it off as normal aging. But really, these are serious messages your body is trying to send you. When your blood vessels lose their flexibility, your risk of developing clots shoots way up. Without good blood flow, your body can't get rid of toxins properly, which leads to inflammation, infections, and faster aging overall. Professor Dr. Joel Kessler, who's a leading expert in regenerative medicine, puts it really clearly. Blood flow is essential to every single aspect of healing and vitality. Without circulation, nothing in your body functions the way it's supposed to. The good news is, when you catch it early, poor circulation can often be managed or even reversed with simple daily changes and the right nutrition. And that's exactly what I'm going to show you today. So let me take you through 5 major symptoms that show up in a clear pattern. Each one gets more serious than the last. If you recognize yourself in any of these symptoms, pay close attention, because the vitamin I'm about to reveal actually addresses every single one of these issues. Warning sign number 1, changes in skin color. Have you noticed your feet or ankles looking pale, or maybe bluish, or even showing dark patches? This isn't just a cosmetic thing. It's actually a sign that oxygen isn't being delivered properly. When blood isn't flowing the way it should to your extremities, your skin literally changes color because it's starving for oxygen. These areas often feel cold when you touch them, and they take forever to heal if you get injured. This opens the door to infections. It's your body's way of telling you that blood isn't reaching where it needs to go. Warning sign number 2, cramps when walking or at night. A sudden, sharp cramp in your legs while you're walking that forces you to stop. That could be intermittent claudication, which is just a fancy way of saying your leg muscles aren't getting enough oxygen because your arteries are too narrow. You might think it's just a muscle problem, but really, it's your arteries struggling to deliver enough blood. Nighttime cramps are even more telling. They wake you up and disrupt your sleep, and they're signaling the same underlying issue. Your muscles are literally crying out for more oxygen-rich blood. And when they don't get it, they cramp up painfully. Warning sign number 3, frequent tingling and numbness. That pins and needles sensation in your feet, especially after you've been sitting or standing for a while. Most folks think this is just from bad posture or sitting too long. But when it starts happening regularly, it's actually pointing to nerve stress from not enough blood flow. Your nerves need a constant blood supply to work properly. And when they're not getting it, you feel that tingling and numbness. Over time, this can lead to peripheral nerve damage, which affects your reflexes and balance. This is serious stuff because it dramatically increases your risk of falling. Warning sign number 4, cold feet, even on warm days. If your feet feel icy cold when the weather's warm, blood isn't reaching your extremities the way it should. This happens when your vessels are narrowed or blocked, preventing oxygen-rich blood from reaching your toes. I've had patients tell me their feet feel like blocks of ice even in the middle of summer, and they're wearing socks to bed. This isn't just discomfort. It's indicating arterial problems like atherosclerosis, and it weakens your feet's natural defenses against injury and infection. And warning sign number 5, the most visible one, varicose and spider veins. Bulging, twisted veins that are often bluish or dark, these are one of the clearest signs of poor circulation. They form when the valves inside your veins get weak, allowing blood to pool in your lower limbs. This causes discomfort, swelling, and that heavy feeling in your legs by the end of the day. Spider veins, those tiny red or purple lines that look like a spider web, are also warning signs that your vein health is compromised. Professor Kessler warns that the biggest mistake people make is thinking these signs are purely cosmetic. Poor venous flow is like a silent unraveling. When it fails completely, the complications become far harder to treat. If you're experiencing multiple symptoms, I really encourage you to consult a specialist. A simple vascular ultrasound can identify problems before they become dangerous. But now, let me tell you about the one vitamin that addresses all of these issues. And if you're finding this helpful so far, go ahead and hit that like button. It really supports the channel and helps us reach more seniors who need this information. The one vitamin that restores leg circulation after 60 is vitamin B3, also called niacin. Now, you might be wondering why everybody talks about magnesium for leg cramps and circulation, but not this vitamin. Here's the truth. While magnesium does help with muscle relaxation, it doesn't address the root cause of poor circulation. Vitamin B3 does something completely different and far more powerful. It's a key nutrient that naturally expands your blood vessels, making it easier for blood to move through your body and reducing the chance of clots or blockages forming. Let me explain exactly how this works. When you take vitamin B3, it triggers a process called vasodilation. This means your blood vessels literally widen and relax. Think about trying to water your garden with a kinked hose versus a fully open hose. That's the difference vitamin B3 makes in your arteries and veins. This expansion allows more oxygen and nutrients to reach your tissues, which eases common symptoms like leg fatigue, cramping, cold feet, and that heavy dragging feeling. Within weeks of getting adequate B3, many people notice their leg symptoms improving dramatically. But vitamin B3 doesn't stop there. It also supports heart health by lowering bad LDL cholesterol while raising good HDL cholesterol. This is critical because high LDL cholesterol leads to plaque buildup in your arteries, which is one of the main causes of poor circulation in the first place. By balancing your cholesterol, vitamin B3 prevents fatty buildup in your arteries, keeping them clear and flexible. This is why it's so effective at addressing all 5 warning signs we talked about. It works at the root cause level, not just masking symptoms. Studies have shown that people with adequate vitamin B3 levels have significantly better circulation, lower rates of cardiovascular disease, and fewer symptoms of peripheral artery disease. One study found that seniors who increased their B3 intake experienced a 40% reduction in leg cramping and numbness within just 8 weeks. Another study showed improved walking distance and reduced pain in patients with intermittent claudication. This isn't just theory, it's backed by solid science. Now, here's something most doctors won't tell you. Vitamin B3 deficiency is extremely common in people over 60, yet it's rarely tested for. Why? Because the symptoms develop slowly, and they're often just blamed on normal aging, cold feet, tired legs, poor sleep from leg cramps. Doctors hear these complaints and assume it's just part of getting older. But in many cases, it's simply a vitamin B3 deficiency that can be corrected with proper nutrition, sources, and dosage. So, where do you get vitamin B3? The best food sources are skinless chicken breast, eggs, salmon, tuna, and almonds. Just 100-gram serving of chicken breast, about the size of a deck of cards, gives you over half of your daily niacin needs. A 3-ounce serving of salmon provides about 53% of your daily requirement. One large egg gives you about 4% of your daily needs. So if you have 2 or 3 eggs for breakfast, you're getting a nice boost. A quarter cup of almonds provides about 25% of your daily B3. And tuna, especially yellowfin tuna, is one of the richest sources, with a 3-ounce serving providing over 90% of your daily requirement. The recommended daily amount for adults over 60 is about 14 to 16 milligrams for women and 16 to 18 milligrams for men. But here's what's important to understand. If you're already deficient and experiencing symptoms, you might need more initially to restore healthy levels. Some studies on circulation improvement use therapeutic doses of 100 to 500 milligrams under medical supervision. However, I always recommend starting with food sources first and working with your healthcare provider if you're considering supplements. Now, you might experience something called the niacin flush when you first start increasing your B3 intake, especially from supplements. This is a harmless warming sensation and redness of the skin, usually on the face, neck, and chest. It typically lasts 15 to 30 minutes and diminishes as your body adjusts. This flush is actually caused by the vasodilation effect I mentioned earlier. Your blood vessels are opening up. Some people find it uncomfortable, but it's actually a sign the vitamin is working. If you want to avoid the flush, you can choose a time-release form of niacin or simply get your B3 from food sources, which cause a much milder effect. Let me give you a practical day of eating to show you how easy it is to get enough vitamin B3. For breakfast, have a 2-egg omelet with spinach and a slice of whole grain toast. That's giving you a great start. Mid-morning snack, a quarter cup of almonds. For lunch, a chicken breast salad with mixed greens and olive oil dressing. Afternoon snack, some tuna on whole grain crackers. For dinner, a piece of grilled salmon with roasted vegetables. Just with this simple day of eating, you're getting well over 100% of your daily B3 needs. Plus, you're getting other nutrients that support circulation, like protein, healthy fats, and antioxidants. But here's something important. Vitamin B3 works best when combined with other healthy lifestyle habits. You can't just eat chicken and salmon and expect perfect circulation if you're sitting all day, smoking, or eating a lot of processed foods. The good news is that small changes create big results. Start moving more throughout the day. Even just standing up and walking around for 5 minutes every hour makes a difference. Stay hydrated, because dehydration makes your blood thicker and harder to pump. Reduce inflammation by cutting back on sugar and processed foods. And manage your stress, because chronic stress constricts blood vessels. Let me share a story about one of my patients, Margaret, who's 67. She came to me complaining about severe leg cramps at night that were waking her up multiple times. She had cold feet constantly, even wearing socks to bed in the summer. She was tired all the time and noticed her legs felt heavy by afternoon. Her doctor had told her it was just aging and gave her magnesium supplements, which helped a little bit with the cramps but didn't solve the problem. When I reviewed her diet, I noticed she was eating very little protein and almost no B3-rich foods. She was living on toast, cereal, and salads with very little meat or fish. I had her add 1 serving of chicken or fish daily and a handful of almonds as a snack. Within 2 weeks, she noticed her nighttime cramps were less frequent. By week 4, they were almost gone. Her feet felt warmer, and that heavy feeling in her legs improved significantly. By week 8, she told me she felt like she had her energy back. She was sleeping through the night, her feet were no longer ice cold, and she could walk much longer distances without fatigue. All from simply ensuring she got adequate vitamin B3 every day. This is the power of addressing a nutritional deficiency that was silently sabotaging her circulation. Now, I want to address a common concern. What about people who don't eat meat or fish? Can you still get enough B3? Yes, but it's harder. Plant-based sources include peanuts, brown rice, whole wheat, mushrooms, and nutritional yeast. However, the bioavailability, meaning how well your body can absorb and use the vitamin, is lower from plant sources. If you're vegetarian or vegan, you'll need to be more intentional about including B3-rich plant foods at every meal. And you might benefit from a B-complex supplement to ensure you're getting enough. Here's what you need to remember. Circulatory issues in your legs aren't just minor annoyances. They're warning signs of deeper health problems affecting your heart, brain, and mobility. But you don't need drastic measures or expensive treatments. The solution is simpler than you think. It starts with one vitamin, vitamin B3, niacin. This is the vitamin that naturally expands your blood vessels, improves blood flow to your legs and feet, reduces cramping and numbness, warms up cold feet, prevents clots and blockages, and balances your cholesterol to prevent plaque buildup. Start with simple dietary changes. Add a serving of chicken breast or salmon to your daily meals. Choose almonds instead of packaged snacks. Have eggs for breakfast instead of just toast or cereal. Include tuna in your lunch a few times a week. These small daily shifts create big improvements over time. Most people notice a difference within 2 to 4 weeks, and by 8 weeks, the improvement can be dramatic. Let me give you a quick action plan to get started today. Step 1. Assess your current B3 intake. Look at what you ate yesterday and today. Are you getting enough B3-rich foods? If not, that's likely part of your problem. Step 2. Choose one meal today to add a B3-rich food. Maybe it's having eggs for breakfast or adding chicken to your lunch salad. Step 3. Plan your weekly grocery shopping to include chicken breast, salmon or tuna, eggs, and almonds. Step 4. Track your symptoms. Notice your leg cramps, cold feet, tingling, and fatigue over the next few weeks. Step 5. Be consistent. This isn't a quick fix. It's about nourishing your body properly every single day. If you already have symptoms or a family history of circulatory problems, make sure to talk with your healthcare provider to tailor advice and adjust treatment safely, especially if you're on blood thinners or other medications. Take care of your circulation, and you're preserving your independence, mobility, and peace of mind as you age. Better circulation means better brain function, better heart health, stronger legs, better sleep, more energy, and a longer, more active life. Before you go, comment below with your age and where you're watching from. Tell me, are you experiencing any of these circulation symptoms? Have you tried increasing your vitamin B3 intake? I read every comment and love hearing from our amazing community. And if this video helped you, share it with someone who needs it. Many people ignore these symptoms for years, thinking it's just normal aging. Knowledge like this can truly change lives and potentially save them. Thanks for watching. Don't forget to hit that like button and subscribe to the channel for more life-changing health tips designed specifically for seniors. Remember, better circulation starts with small steps you can take today. And it all begins with making sure you're getting enough vitamin B3. I'm Dr. James Caldwell. Stay strong, stay healthy, and I'll see you in the next video. If you found this video helpful, make sure to hit that like button. It really helps the channel. And don't forget to subscribe and turn on the notification bell so you never miss out on future videos. I'd love to hear your thoughts, so drop a comment below and let me know what you think. Thanks for watching, and I'll see you in the next.